Hello, everyone, and thank you for joining me for this absolutely free webinar. I'm so excited that for the next 30 minutes, I get to share with you the secrets and the steps to be able to properly qualify a new patient over the phone. My name is Sean Crabtree. My company is called the Crabtree Group, and for the last nearly 20 years, I've worked very closely with dentists and dental teams from Vancouver, British Columbia, all the way to Barbados, and from Nassau to the Great Lakes, and all across America. And this is absolutely one of the most important subjects that we can have: qualifying the new patient. For the next 30 minutes, again, all we're going to talk about is this. I'm excited that you're here. I appreciate you joining me, and I just want to jump in as quickly as possible to give you as much information as we can. So, what do I mean when I say properly qualifying a new patient? Well, think about it like this. When a potential new patient calls your office and they schedule for, let's say, a cleaning perhaps, or whatever it is that they're scheduling for, then if the patient is not properly qualified, when they show up, in their mind, they're there for one reason, right? And that's the cleaning. Well, of course, when the doctor looks in the mouth and there's $8,000 worth of work, that comes as a total shock to the patient. The patient wasn't expecting it because in their mind, they're simply here for a cleaning. Properly qualifying the patient means that the patient, if we do this properly, the patient will not get any surprises, the doctor will not get any surprises, and the patient can be in a much better mindset of buy-in. So I want to share with you again for the next 30 minutes as much as I can about these steps. And I want you to really get this. This can be not only a game changer for your practice, this can be a life changer. So when we think of, obviously, properly qualifying a new patient, what we're really talking about is that first point of contact. Now, I know some of you guys who are listening to this and watching this, you have patients that contact you from digital sources, maybe email or whatever, as a first point of contact. Obviously, what you want to do is turn that into a person-to-person phone call, because that's the only way that you're going to have a give and take conversation, and you must have a give and take conversation before you can get the patient to this place. So whatever that first point of contact looks like for you, let's do what we need to do to turn that into an actual phone call where you're able to talk to the patient. Another thing that we need to mention is if somebody else is calling for the patient, you want to talk to the patient, because that's the person that you're trying to make the relationship with, and that's the one that you're trying to properly qualify before they come into your office. So make sure that if a spouse or whatever is on the phone first, that you actually get to that patient. If you need to call them back, go ahead and set that time to be able to call them back and make sure that that's a proper number, and then talk to the patient to be able to get the qualification process done properly. All right, so having said all of that, there are really 5 steps. We have an acronym for it. We call it LAMBS. LAMBS. And I want to walk through what each of those steps are, and I want you to really get this. So when a patient picks up the phone and they call your practice, or let's say again that they've emailed and you respond to the email and set up a call, and now you're talking to the patient, you want to first listen for why it is that the patient is calling. Now, you guys know that you get all sorts of calls. What do you charge for a cleaning? How much is a crown? All of these kinds of questions. You always want to listen, because that's going to give you why the patient believes that they're calling. Now, there could be a lot of other things that they should be calling for, and that's one of your jobs in these 5 steps. But you do want to know what the reason is that the patient is calling. So listen for that, and then as soon as you know why it is that they're calling, you immediately take charge of the conversation by asking the questions. Now, interestingly enough, if it is an email scenario that the patient first reaches out to you and then you set up a phone call, then of course you may have to ask some questions to get the patient to tell you why it is that they're calling. But as soon as you listen for why it is that they're calling, you're then going to take control by asking questions. These are big picture, open-ended questions. And I'm going to talk about that in great detail in just a minute. Big picture, open-ended questions. As much as you can, these are questions that are going to begin with what or how. Try to eliminate questions that start with do you, did you, won't you, would you, could you, should you, have you, will you. All of those kinds of things are closed-ended questions. Those are questions that the patient can answer with yes or no. Part of the qualifying process is you want to bring this patient with you on this journey. Yes, it's important that you have the information from the questions that you're asking, but what's more important is not only that you get that information, but that you bring the patient along with you on this journey so that they're engaged in the process. If you're asking questions and they're able to give you yes or no kind of answers, then they're just checking the box and they're not engaged. So you're going to listen for why the patient's calling. You're going to immediately take control of the conversation by asking open-ended questions. One of the things we talk about in all of our programs is this: the person who asks the questions controls the conversation. That's very, very important. If the patient is allowed to ask questions and they control the conversation, you're not able to help them. And I know that in healthcare, you guys are some of the most altruistic, people on the planet. And so when a patient asks a question, you really, really want to feel like you're doing a good job in serving the patient by answering. It really doesn't work that way. The best way for you to support the patient at the highest level is for you to be asking questions. So we're going to walk through these again in just a minute, but you're going to ask open-ended, big questions that begin with what or how. Now, the goal, this is the next step. The goal, as you're asking these questions and listening with the patient's answers, you want to get the patients talking so that you can magnify these answers along the way. You want to, what's another word for magnify? You want to build it up. You want to show some emotion here. You want the patient to hear you sort of make that position bigger. And we'll talk about that in just a second. So I'm going to listen for why the patient's calling. I'm going to ask open-ended questions. Immediately by taking control of the call, asking open-ended questions, and magnify along the way, because where I'm ultimately trying to go is I'm trying to bring the patient to the proper realization. And what I mean by that is if the patient is calling because they want to know what we charge for cleaning, or they want a cleaning, or whatever it is that they're calling about, maybe they're calling about a whitening special or whatever it is, I want to ask the questions and magnify along the way so that I can have the patient come to the full understanding of why they could or should be calling, in addition to the reason that they originally called. And I'll tell you what that means in just a second. And then the last thing I'm going to do is set the final expectations, dentally, clinically, logistically, financially, and all of that. So these are the 5 steps. Let's break them down and let's talk about it. And really the best way that I've found to talk about this is to use a different analogy. Let's don't even think about it in terms of dentistry. Let's think about it in terms of another everyday occurrence. Let's say that you need an oil change, okay? And I'm the oil change company. I'm ABC Oil Change Company. So you pick up the phone and you call ABC Oil Change Company. And I say, thank you for calling ABC Oil Change. And you say, yes, a friend of mine told me that you guys have a $29 oil change special. And so I'd like to set an appointment to get my oil changed. Now, at this point, I can qualify the customer or I can set the appointment. And far, far, far too often what we see in dentistry is the appointment is being set, no expectations, none of this is happening. The patient shows up, there's a whole bunch more than what they expected, and they're not in a proper buying mindset, and so they walk away and they don't make a move. What you want to do is not allow that to happen. So back to the oil change analogy. You say, yes, I'd really like to get my oil changed. At that point, I can say, okay, great. So we could see you at 8 a.m. tomorrow. Now, If you show up at 8 a.m. tomorrow and I go have my guys to change your oil, and then what they figure out is you got no oil in there at all because it hasn't been changed. And by the way, there's 17 things going on with the engine that we didn't know about, right? And we can't even change your oil, and it's going to cost you $2,800 just to get the thing back to the engine back to where it should be. Well, if I tell you that, you're going to be like, well, wait a minute. The car drove fine when I came in. You know, I just came to get the $29 oil change. Now you're telling me it's $2,800? I mean, I totally wasn't prepared for that. I'll just have to talk to my husband or I'll talk to somebody else. Thank you, right? Versus here's the way it could go. Thank you for calling ABC Oil Change. Yes, a friend of mine told me that you guys have a $29 oil change special, and I'd like to make an appointment to get my oil changed. Now, what I'm going to do, I've listened for why the patient is calling, or the customer in this example. Now I'm going to ask open-ended questions as much as I can, open-ended questions, magnifying along the way and bringing the patient to the proper realization. So it might go, great. So who am I talking to? Well, my name is Jenny Smith. Wonderful, Jenny. And so let me ask you a few questions here. What kind of vehicle do you have? Well, I've got a Toyota Avalon. Okay, an Avalon. And what year is that Avalon? It is a 2010. Okay, and how many miles do you have on that Avalon? I've got 110,000 miles on it. Oh, wow. Okay. So how often do you have your oil changed? I usually have it changed every 10,000 miles. And so it's been about, it's been a little bit over that. Really? Every 10,000 miles? You know, the manufacturer suggests every 3,000 miles. Really? Is that a problem? Well, we won't know. We'll be sure, and our guys will take a look at it as soon as you bring it in tomorrow. Let me ask you a couple of other questions. You said you have 110,000 miles on that thing. Have you ever had the timing belt changed? No, I'm not even sure I know what that is. Wow. This is part of the magnifying process. Wow. You know, the manufacturer calls for that to be changed at 60,000 miles. So you're about 50,000 miles overdue on that. Wow, is that a problem? Well, again, our guys will take a look. So we'll really check that out tomorrow, and we'll let you know. So let me ask, do you have any oil? Have you noticed any oil on the floor of your garage? Are you noticing any black smoke? Those kinds of things. And if I say, well, yes, as a matter of fact, I have noticed all of this. So you get the picture, right? I don't know that I can go super deep into this analogy, but you get the picture. I'm asking these questions, and the patient is coming to an understanding that there may be a whole lot more going on than simply a $29 oil change. And that's the whole purpose of what you're trying to do, is to bring this particular person to the proper realization that perhaps the reason that they're calling, while it might be a great reason, there's all these other reasons that they could be calling. So we want to do the same thing when it comes to new patients in our office. And if you think about it, a few questions like that are open-ended, that you're accomplishing several things. Number one, you're getting the information so that you, your team, and your doctor understand a little bit better idea of what you're up against. You're bringing the patient with you along the way so that they have a better idea of what to expect. You're also, because you're asking questions and the patient is answering, you are making a relationship. Now, it may not feel like that because you may have had some references in the past that the best way to make a relationship is for you to do the talking and somebody else to do the asking. You know, I used to believe that years ago myself, but what I've learned is that's really not true. The best way to make a relationship with somebody is to let them talk about themselves and what's most important to them, what's going on in their lives. So when you're asking the questions, you're also making a relationship with the patient. One of the things that our guys notice all the time is that when we walk through this process really well, and then the patient actually shows up, the first thing that they'll usually say is, so are you Jenny? I spoke with you on the phone. And they come in the office actually asking for the person that they talk to on the phone because they feel a connection there. That's great. So you're accomplishing all of those three things. You're also setting up the patient to be in a proper buying mindset, because again, they're not getting a surprise when they walk in the door. Those seeds have been planted. Now, it's possible that the answers that we're getting and the questions that we're asking and so forth, it's possible that those things are not actually what shows up clinically, but we've accomplished what we have to do, which is to make sure that there are no unexpected surprises on our part as much as possible, but mostly on the patient's part. So how that might look in a typical scenario at the office is you pick up the phone and you say, "Thank you for calling ABC Dental. This is Sean." And the patient on the other end says, "Yes. I'm new to the area and I'm looking for a dental home." And this is actually a recorded call that went just like this. "I'm new to the area." We spend a lot of time on recorded calls, walking through this, and have for years and years, almost 20 years, coaching these intake calls. And so this is an actual recording. It was something like this. "Yes, I'm new to the area, and I was wondering, we're looking for a dental home. And I was wondering, what do you guys charge for a normal cleaning?" Now, the person at the front desk absolutely took charge of it and walked through these 5 steps, and I'll show you. Here's kind of the way that went and what she found. She says, "Oh, great. So who am I talking to?" Now I've got the patient's name. Whatever she said, this is Joanne Smith. Now I can use the patient's name throughout the whole process. "Oh, hi, Joanne. Well, my name is Jenny," let's say. "So you're looking for a new home and you want to know about a cleaning. Great. So let me ask some questions, Joanne." And now I'm able to take control. "So when's the last time you've been to the dentist?" Now, you're not going to be able to script this process, you guys, because every situation is different. And the questions that you're asking are really based on the answers that you're getting. So the next question is going to be based on the previous answer and so forth. If you walk into it and you try to script it, every ball is a curveball, right? You're not going to be able to. What's more important is that instead of trying to script it, you're just totally focused and totally present and being with the patient in that moment. Remember, big picture questions. So how often, and we want to start with what or how. So how often do you go to the dentist? Now, if the patient says, "I go to the dentist every 3 months only because I really like to have my teeth cleaned, and I love that feeling, and I've been doing that since I was 5 years old, and I'm 40, and I've never had a cavity." Okay, then the next question is going to be different than if the patient says, "It's been a long time since I've been to the dentist, probably about 20 years, right? This is what I mean by curveball. You're going to have to be really focused on where it is that you're trying to go and focused on LAMBS. So in this particular example, she asked, "So how long have you, when's the last time you've been to the dentist?" She goes, "I used to go regularly, but it's been quite a while." And so Jenny said, "So how long is a while?" And she said, "It's probably been over 10 years. What or how questions? Really? So I'm curious, what kept you away?" "Well, nothing really hurt. And I've just been busy with the kids and travel soccer and all those other things. And honestly, because nothing hurt, I didn't really see the need in going to the dentist. But I just really feel like it's probably time for me to get it clean." Okay, great. So now I'm continuing to ask these questions. "So I'm curious, Joanne, how many missing teeth do you have?" "I don't have any missing teeth." "Okay. How often do you brush?" And we're looking for opportunities to magnify and to bring the patient to new realization. She said, "I brush every day." "So how often? How many times a day?" She said, "Usually twice a day, but sometimes kind of only in the morning." "Really?" Now I'm trying to magnify. "Okay. And how about flossing?" I try to floss a couple of times a week." "Okay. How often do you have bleeding when you brush or floss?" Patient said, actually on the lower in the front, on the lower, I do kind of bleed quite a bit. And so sometimes it's really sensitive, and especially when I floss. So I try not to, I try to steer clear of that area with the flossing or with the toothbrush because it is sensitive. Now she says, oh my, really? So have you ever been formally diagnosed with periodontal disease? Patient said, no. Do you think I have that? Well, it's certainly not natural. You shouldn't bleed like that, and you shouldn't be sensitive. But the doctor will take a look, and we'll know all about that when you're here for the exam. So let me ask you some more questions, Joanne. Do you have any sensitivity in terms of your teeth, any cavities that you feel like you have anywhere in your mouth? Any sensitivity to hot or cold, or when you chew ice, or something like that? As a matter of fact, on the lower right-hand side, in the back, I do have a really sensitive area. It doesn't hurt all the time, but it's really sensitive to cold. Really? Okay. And is it loose at all? No. Okay. And you said you haven't had that checked out. And how long has that been bothering you? Right? Now, as you can tell, I could go through this example, but as you can tell, this is a whole lot different than me just scheduling the patient for a cleaning and having them show up with the expectation that they're simply here to get their teeth cleaned. By me asking all of these questions and then planting those seeds by magnifying the answers along the way, I'm able to bring the patient to a much different realization of what actually could be found at the hygiene visit, or excuse me, at the full comprehensive exam on the front end. And so I'm magnifying those examples, magnifying. Then I'm going to, once the patient is to a proper realization, now we're in a whole different place. It's interesting. You'll notice that you've got the patient at the proper realization because you feel the conversation switch. It'll go from what I call a push to a pull. And what I mean by that is the patient will actually be pulling the appointment from you, which is exactly what you want because the patient now has the proper understanding. They've got a little bit of a sense of urgency about it. And of course, that makes setting the appointment and the rest of it so much easier. Instead of you trying to push the patient into it, the patient is now pulling it from you. And that's when you'll know that you've brought them to a proper realization. So back to the analogy, how it might go with this particular patient is, so you've never been, let's see, I think, so I asked her, or in my analogy, I just asked her, so have you ever been formally diagnosed with periodontal disease? No. Do you think I have that? That's a pretty good signal that we're getting the patient to the proper realization. That doesn't mean I want to slow down yet, right? But we're moving toward that way. So I'm going to continue to ask questions. How many missing teeth? I shared that. There was a little bit of sensitivity on the lower right side, so I'm just going to keep going. Do you notice any discoloration anywhere on any of your teeth when you smile in the mirror, right? And all of these things are bringing the patient to the proper realization of what it could look like. Now, once I'm there, and oftentimes we find this, as you keep going with these questions, a lot of times the patient will, because they're in this new realization, they'll flip the conversation very quickly. And at some point, the patient may even say, wow, I got a lot going on. So do you guys have any kind of payment plans? Oh, that's perfect. That tells you that the patient is now pulling the appointment. They're under the proper realization. They have a good idea of what all the things could possibly look like. When they ask a question like that, now I'm going to want to answer it and throw the question right back in their lap. So do you guys have any payment plans? Oh, yes, Joanne. As a matter of fact, we do. We've got all sorts of payment arrangements. Interest-free up to 36 months. How's your credit? Right? Now I'm setting the expectations financially. If the patient says, oh, I had a bankruptcy or whatever, then that's going to tell me what's going on and whether or not the patient has an issue with their credit. If they say, it's pretty good as far as I know, okay, great. Now I can go about setting the final expectations, which are things like, name, birthday, all the stuff that you guys normally get, social security number. If there's insurance involved, then you're going to get that information, and then set the appointment. And then, of course, set up if you're going to email or whatever, the new patient paperwork and the health history and all of that. But if you find out that the patient has a challenge, if you get to that point and the patient does have a challenge with the credit, then you can also set those expectations differently. No worries. We can do a pre-approval process. I can do that in just a second. It doesn't require anything, and then I can let you know. And at that point, of course, I can make a request that she bring her husband or whatever so that we can have a co-signer for the process. That allows me to set the final expectations. As you can see, this is a completely different process than simply answering the phone and scheduling the patient. Now, a couple things. I know what you're thinking. Oh my goodness, how in the world am I ever going to have time to spend all of that time on the phone? I've learned after, I don't know how many thousands of recordings over the last 20 years, this is not a long process. Now, warning, it may be a little bit longer at first as you're learning what it is that you're trying to do, but we're talking about at the maximum a single unit of time. Normally what we see is 4 to 6 minutes. And here's what you need to ask yourself. Instead of asking, how am I going to have time to do that? Ask yourself, how much is the time with your doctor in your schedule worth? Because the time that you spend on the phone properly qualifying the patient can save you tons of productivity time, tons of wasted time after the fact. And we'll talk about that in just a second. But that's where you need to focus your energy. This is probably the most important time that can be spent so that your chair time, your productivity time, your schedule, even the time that you spend in the financial is not wasted. You get the patient in the proper mindset. Everybody is on the same pace. There's no surprises. So when the patient comes in, that chair time is spent in a much more valuable way. So I would really challenge you to put your focus on getting good at this. 4 to 6 minutes, right? And it's not even about the time. Listen, if it takes you longer than that to get the patient properly qualified, it's well worth it because you're saving that chair time. Now, what are some sure signs that your patient that you brought in today is not properly qualified? Well, you guys already know what those are. The patient shows up, we spend an hour and a half or an hour and 40 minutes on the new patient process, and we get to the end and the patient is surprised, right? And they say, I have to go talk to my wife or I have to go talk to my husband. Basically what they're saying is, I had no idea. I wasn't expecting that. I really just came in for a cleaning. Something else. When you find out that they weren't able to make that decision because the spouse is the decision maker, as I'm walking through all of this, that's one of the things that I can get clear on through the intake call. If the spouse is the decision maker, I want to have the spouse come with this patient. If we're talking about a potentially big, opportunity or scenario, so I can overcome that. Another way is if the patient is not prepared financially. And I know this sounds silly, but a lot of you guys who are listening to this, I mean, I'd love to know, right? How many times have you run into the situation where you spend an hour and 40 minutes with the patient? We've got a $12,000 treatment plan, and we try to, use a third-party financing company, and they've had a bankruptcy. There's no way they can get credit. They got no money. They don't have a job, whatever. All of these things that really, really could have been found out on the front end. And it's not that I'm trying to get you to be totally selfish. Of course, I want you to be selfish for your doctor's time and your time and the schedule. But it's also about the patient's time. Listen, there's no sense in us wasting an hour and 40 minutes or however much time you spend on a comprehensive exam. There's no sense in us wasting the patient's time as well, only to find out what we could have found out on the front end by asking these questions. This is the way you do it. LAMBS. Listen for why the patient's calling. Immediately take control by asking open-ended what and how kinds of questions, magnifying along the way to ultimately bring the patient to the proper realization so that you'll feel it switch and the patient will then pull the appointment from you and now you can set whatever those final expectations are. This is one of the most crucial aspects of treatment acceptance. It is also a big opportunity for you to get control of your schedule. A side note, one of the things that we find is teams and doctors are always looking for more new patients, more new patients, more new patients. What we find a lot of times is when we dive in, they've only got about a 19% acceptance rate because they're not doing any of this on the front end. Now, there are other steps, obviously, to the treatment acceptance process, but this is the most important because it's the first touch. If you've got a 19% acceptance rate and you're going after more new patients, all you're doing is adding more patients, more overhead, more expense to continue to maintain a 19% acceptance rate. Instead of going after new patients, figure out how to make use, maximize by this process the new patients that you already have. Instead of having a 19% acceptance rate, have a 98% acceptance rate and watch your practice soar. I'm really excited to be able to share this information with you. I'm passionate about it. I hope it shows. I'm not used to talking to a camera, but all of you guys that are listening, I very much appreciate you joining me. And this is great information that you can take away from a totally free webinar. Please stay tuned. We'll be having more of these that we'll be letting you know about. And also check us out on thecrabtreegroup.com. Have a good day. Thank you for joining me.